Hi, I'm Jamie Yeo. Good afternoon. Welcome to this Unity Facebook Live. Today is the very first of a series of webinar we call Unity Beautiful Inside Out. And it's an honor to be here today. We have invited 3 experts who will be here to talk about eczema care for adults and children. And we'll also be touching on beauty supplements, namely collagen and stem cell beauty supplements. Before I invite the speakers to start presenting, though, I want to tell you something because you guys have been very patient, waiting for us here for this Facebook Live to start. So I wanted to tell you about this $5 Unity voucher that we're giving away to the first 300 of you who take part right now. All you need to do is to look for the Google form that's pinned to the comments section here. Fill in your address and everything and we'll give you that $5 Unity voucher. The only terms and conditions, it's valid until the 25th of January at all Fair Price and Unity stores. And there's also a small minimum spend of $25 on health supplements and toiletries. Okay, so if you want that $5 Unity voucher, you know what to do. Register right now in the Google form below. Okay, on to my experts. They've been patiently waiting here already, and I've actually gotten so much information about eczema care from them already. But of course, we're always excited to hear more. First up, I'm very honored to present to you Dr. Paul Chia. Now, Dr. Paul Chia will be talking about eczema management. As you know, eczema is a very real and I would say very crippling skin condition because once you have it, it's really like a lifelong management and it's a lifelong battle really. So it's good to have proper advice from specialists such as yourself, Dr. Paul Chia. Dr. Paul is a consultant dermatologist and MOHS surgeon from the dermatology practice. Dr. Chia, thank you so much.
Hi, thanks, Jamie. Hi, I'm Paul. Thank you for allowing me to share some of my tips on eczema management.
It's the 4 M's, right?
That's right.
Eczema management.
Yeah, today I'll be talking about the 4 M's of eczema management. And some of the points that I raised may be a bit controversial. Anyway, I am a consultant dermatologist and I practice at the dermatology practice at Mount Elizabeth Hospital. So the aim of my talk today is really to share about practical tips on how to manage eczema and to emphasize that eczema is not just about using different creams, right? But eczema is really about combination treatment, and I summarize that in the 4 M's of eczema management. All right. So next, please. So what are the 4 M's of eczema? The 4 M's of eczema would be: the first M is making the right diagnosis and the correct assessment. The second M is really to debunk the many myths that surrounds eczema. There's so many myths about eczema, and today is the right time to just speak to you about them. And the third one is really the most important thing about eczema really is to moisturize your skin. And finally, then we talk about using what most people talk about would be your anti-inflammatory creams like the steroid creams. So let's go to the next slide. The first thing really about eczema is really making a proper diagnosis and a proper assessment of the patients. Next, please. Now we know that eczema is really common amongst
I cannot look at pictures of eczema.
Yeah. Very sorry.
But this is, we need to discuss this.
Right. Yeah, anyway, eczema is really common, and you will know that about 20 to 30% of our children have eczema, and especially in Singapore, eczema tends to be more severe because of the very hot and humid climate. And as the child grows older, most of them will improve, but the pattern of eczema also evolves. So you see that in childhood, Dr. Ker will explain more about childhood eczema, but in childhood there's a certain pattern, and as the child grows older, they change. But of course, before we even call an eczema, we need to make sure that it's eczema. But more importantly, in today's talk, I want to go to the next slide, please, is to also consider other important factors that may be affecting people who suffer from eczema. So, for example, in the picture on the left, stress. Stress is a big factor in Singapore. Life in Singapore can be so stressful. Certainly, stress can make eczema worse. And sometimes not having enough sleep can make eczema worse. The next thing is certain allergies. Alright, mark my words, allergies can make it worse, but they are not the cause of eczema. And finally, of course, sometimes when eczema worsens, it can be caused by skin infection. So we have to consider all these. Next, please. Next slide, please. The next thing is really to debunk the many myths about eczema. Can I have the next slide? Right. So a lot of people, when they see us, they think that there is a particular magical cream, that you apply for about 2 weeks and then your eczema will disappear. Well, sadly to say, there isn't such a cream. And there are very often also we have people coming to us thinking that no, we are that specialists, and just because I practice in Mount Elizabeth Hospital, I had that the magical elixir to cure eczema. Unfortunately, we don't. But there is a lot of things that can be done for eczema. And certainly, in my own practice, I've seen many patients who have suffered from eczema who have improved significantly to live a normal life. All right, and finally, we also talk about the fact that eczema is not really caused by allergies. Many parents come to us asking for many allergy tests, and they go from specialists to specialists, doctors to doctors, to look for that particular allergy that may be eluding their child. But truth be told, most eczemas are not caused by allergies. All right. Now we go to the next slide. And I always emphasize a few important points to my patients. The first thing is that eczema is a chronic condition. That means it's not something that we apply a cream and 1 week later it goes away. It's not a flu, it's not a cough, but it's something that you have to learn to live with. But there are many ways to control eczema properly. And eczema is not just about finding out the allergy. Eczema is about the cause of eczema is a genetic predisposition, as well as the fact that our skin is lacking in certain lipids, certain moisturizing factors, which we will address further later on. And the most important thing is eczema is a combination effort. It is much more, it is about the doctors advising you, but at the same time, it's also the patients themselves putting a lot of effort themselves to improve their condition. I'll go to the next one, please. The next slide. Well, the next point, the next M is moisturize. Moisturize, moisturize, moisturize. Why is moisturizing so important? Because the cause of eczema is actually a lack in a genetic predisposition to a lack in certain lipids in our skin. Can I have the next slide? Next slide, please. And as you can see, this is a picture of our normal skin. This is a very nice cartoon about our skin is akin to a brick and mortar model. When you have a good skin, you actually have nice bricks, which is our skin component, together with the mortar. Mortar is actually like your moisturize, your skin lipids, right? Next slide. And in people with eczema, they have impaired lipid processing, so the skin kind of like breaks down like a wall that is not lined by the right cement. So the moisturizing cream, in a way, is to help to put things together and ease your skin and make them well. Next slide, please. So what then is the ideal moisturizer? The ideal moisturizer is actually a proper skin barrier cream, and we typically say that the moisturizer should be devoid of fragrance. They should be devoid of sensitizing components, ingredients, and these commonly are your preservatives, fragrances, and your lubricants. So a cream like a QV cream, essentially this is Australian made, and they are specially formulated for sensitive skin, and they are made of squalene to soothe the skin, and at the same time they are a product that is devoid of fragrance and of any color, so that they can soothe our skin. Next, please. We also must remember to use the proper type of wash. Our wash should be soap-free, must be pH balanced, because the alkaline soaps, right, they tend to dry our skin out as well. Next, please. And finally, then even after we've talked about it, then we start talking about using anti-inflammatory treatment. The most common anti-inflammatory treatment most people will associate with is steroidal creams. And you know that many people are worried about using steroids because of inappropriate fear of steroids. So we call that steroid phobia or steroid withdrawal syndrome. But steroid creams are not the only treatment for eczema. The other type of anti-inflammatory creams would be your topical calcineurin inhibitors. So these are the two main groups of creams. Next, please. Steroid creams are, if used appropriately and used for short term, they are actually very safe. And sometimes, I have patients who are really concerned about using steroid creams because they have an inappropriate or misconception that steroids can harm their body. All right, next, please. So, most of the time we may not need to use a steroid cream if we even moisturize our skin properly. So if you use a QV flare cream, they are actually quite good to soothe a mildly inflamed skin. Next please. And the common side effects of steroid creams would be, the most common side effects would be whitening of the skin and sealing of the skin. And very rarely, if you use on huge areas of the skin and you use for long periods of time, then you have what we call systemic side effects, like suppressing our body's production of steroids. But other than that, short-term use of steroid creams can actually soothe the itch and allow the child or the patient to be symptom-free. Fine. Next slide, please. And then we talk about calcineurin inhibitors. Calcineurin inhibitors are not as well known as steroid creams. They are anti-inflammatory creams. That means they treat the inflammation, but they do not contain steroids. Now, a few things about calcineurin inhibitors. They do not contain steroids, so they do not have the steroid side effects. They do not cause thinning or whitening, but in a small proportion of patients, when they first use these creams, they can have a little bit of burning and stinging sensation. So we have to warn our patients about it. Now, I like to use these creams for particular instances. Next slide, please. I like to use it, pardon for some of the inappropriate images, I like to use it for areas where you have sensitive and thin skin. That will include your eyelids, your face, if you have eczema, and also on your genitalia where the skin is very, very thin. And of course, topical calcineurin inhibitors, they are extremely good for maintenance treatment for people who want to prevent recurrent flares of eczema. Next slide. So in conclusion, I just want to highlight a few things again. First, eczema is a chronic and relapsing condition. Yes, there is no cure for eczema, but there is a lot of ways to treat eczema. Eczema treatment is not just about using creams, not just about moisturizing, but there are many more treatments. We also can use light treatment, we can use immunosuppressive treatments, and of course, in today's age and advanced medicine, there is also biological treatments that can treat eczema appropriately. And eczema is not about finding the right allergy. Eczema is not about using steroid creams, but eczema is a combination treatment in living the right lifestyle and also applying your moisturizer, and it is the 4 M's. So with that, thank you very much. I'll pass my time back to Jamie.
Thank you very much, Dr. Paul. Now, you mentioned that many of your clients or your patients are kind of afraid to go into the anti-inflammatory methods, right? Because we've all heard horror stories about steroid cream. So that's why you mentioned about good skincare, because if you moisturize, you can prevent eczema, right?
Certainly.
Yeah, so that's why we're here to talk about the QV range of skincare products. You mentioned it in your presentation, and it's actually recommended by dermatologists such as Dr. Paul, and it's the #1 brand used in Singapore hospitals. And you were saying something about lipids, and these can make sure your building blocks on your skin is in order.
Yes.
Right?
Yes.
See, I gleaned a lot from your presentation. So I'm very curious actually about this QV cream that you've mentioned. You mentioned that like even the cleansers are important, and we have the QV cleanser here, but I'm going to be testing this out here today. So no fragrances, no irritants in their formula, and no colors as well. This is 1 kg, by the way, but you were saying that you need to frequently apply. How often do you apply something like QV cream, let's say,
right,
in
so
eczema?
if you have eczema, I would say a minimum of 2 times a day, but you can apply for as often as you like. If your skin is extremely dry, I'll recommend that you apply as soon as you feel dryness on your skin.
Okay, which is why they have the 1 kg packaging, right?
So QV cream, as you know, is specially formulated for people with sensitive skin and with dry skin, and you can feel the texture.
It's very velvety, very rich.
That's right, and at the same time, there's no fragrance.
Yeah, no fragrance at all.
That's right, and
no coloring.
That's right, and QV is produced specially for people who are suffering from dry and sensitive skin. They have ingredients to soothe the skin, to replace what our skin is lacking in terms of the lipids. And
I know you mentioned you have to apply it twice a day, but if you just happen not to bring it out with you, it's very long lasting.
Yes,
well, you can last for up to 24 hours. So.
In addition, the QV creams, their texture is specially made to be suitable for our texture locally, so they do not feel too occlusive and too uncomfortable.
So we've got a question coming in from an audience who's tuning in right now. What is considered long-term for steroid use?
Well, typically we'll tell our patients, the average patient, we would say that you try not to use for more than 2 weeks. But typically, we would say that, okay, if you use a steroid cream, you use it until your inflammation, as in the itch and the redness, improves significantly, and then you can stop. And you can just replace with either a calcineurin inhibitor, as I've said, or you can just use a moisturizer.
You were talking about the QV flare-up cream, and that's not a steroid cream, right?
No.
So what is it that prevents, suppresses the itch in the flare-up cream?
Right, so the QV flare cream contains povidone, which is actually a soothing component.
Okay.
So it helps to relieve any mild inflammation. Now, take note that this is, of course, not to replace a steroid cream, especially if the skin is severely inflamed.
Thank you so much, Dr. Paul, for those helpful tips and advice as well, and all the science behind it. We actually have a discount going on the QV range of skincare products we've just talked about. We'll bring it in. We'll talk about that later in just a bit. In the meantime, if you're just joining us, thanks for all the comments and the questions coming in. This is, of course, the first of a series of webinars called Unity Beautiful Inside Out, and we covered that earlier when Dr. Paul talked about how with eczema, it's not just what you apply on your skin, but it's also stress, not sleeping enough, taking care of yourself inside out, basically. And we are giving away starter kits from QV. They've been very generous. They've got 200 QV starter kits to give away, and it's very simple. If you're tuning in right now, we want to give it to you, to the first 200 people who sign up for it, okay? So look for the QV Google form pinned to the comment section in this live stream and register away. The people from QV will be mailing it to your addresses in the next 4 to 6 weeks. Oh, I'm just kidding. I'm surprised. I'm acting surprised that Dr. Paul's not here. But yes, Dr. Paul's not here and he's moved over there, because now it is with great pleasure of mine to introduce Dr. Ker Khor Jia, the medical director and consultant dermatologist from Dermatology & Co. Dr. Ker, I'm really glad to have you here today. So Dr. Paul did also mention earlier during his presentation that you'll be talking about eczema management among children, and that's a very real topic, because as parents, if our kids have eczema or just a semblance of it, we get very worried and we kind of want to nip it in the bud. So right now, your presentation, Fight the Eczema Battle, How I Can Build Strong and Calm Skin for My Children, applies to all you parents out there, concerned parents. Dr. Ker, please take it away.
Thank you. Hello everyone, I'm Dr. Ker Khor Jia, pediatric dermatologist from Gleneagles Medical Center. My clinic is Dermatology & Co. Thank you for joining us on a Saturday afternoon. I'll be sharing with you tips on how to manage your baby, your child's skin, especially if your baby has dry, itchy skin, is prone to rashes or prone to eczema. Alright? First of all, how do we know whether does your child have eczema? Is this just a heat rash, for example? If the rash is red, it's itchy, the skin is rough and dry, yes, most likely your child has eczema. So I would recommend actually seeking a professional opinion rather than trying out creams on your own, because sometimes well-meaning friends and relatives can recommend certain products that are not suitable for your child. Eczema itself is really common, and as Dr. Paul Chia mentioned, 20 to 30% of school-going children in Singapore have eczema, and probably that may be underreported. Partially it's due to our weather, but a lot of times people try to find a cause. It's really human nature. You want to find a cause for eczema, you think you eliminate that cause, and then eczema goes off. But unfortunately, it's not so simple. I would think of it as a jigsaw puzzle, alright? Things have to fit together and it comes up, everything just gets together and eczema forms. We talk about internal and external factors. For internal factors, as what Dr. Paul mentioned, genetics. If someone in the family has sensitive dry skin, or for example, sensitive nose, in the morning you wake up, you're stuffy, your nose is blocked, or you have sensitive airways in the form of asthma. If parents or any relatives have these, that means probably your child may have sensitive genes. It's already in the programming, of your child, so genetic predisposition is something we can't change, unfortunately. External factors. The heat, the humidity in Singapore, and children tend to sweat more easily. For chubby kids, sweat accumulates in the neck folds, the folds of the arms, behind the knees. These are the areas that trap sweat, and sweat composed of metabolic waste products actually irritate the skin and cause rashes to appear. Right. If you have school-going children, especially probably the PSLE season just passed, you may find that your child being really quite stressed out about the exams, eczema flares. May or may not be a good thing. Some parents tell me good, they're actually stressed about the exam. So, alright, and other factors, for example, if having renovation, the place is dusty, eczema is triggered. Alright, in Singapore, what happens is that there are certain factors we can control, certain factors we can't. So, the weather, for example, there's nothing you can do about it. But for example, dust mite exposure. If your child has a lot of furry toys on the bed, you may want to consider moving that out of the bedroom, or for example, just leave one favorite toy, wash the other toys frequently every week, machine warm water cycle, sun it to dry. Alright, bed sheets, change it every week. Don't forget the curtains because those trap dust mites as well. Alright, moving on. Alright, to which areas of the body you can find eczema. In children, in infants especially, cheeks or the chin, because that's an area where they drool, they rub against the cords, against the hands, and that's where you get irritation on the skin. Babies can tend to have cradle cap, so that is eczema on the scalp. There may be dry, crusted areas. Remember, do not peel off the crust because then hair would come up together with the crust, and that's not what you want. Okay. Other areas, as I mentioned, areas that trap sweat, the neck, the joint folds on the arms, behind the knees, sometimes on the extensors, which means on the back of the forearms or the knees as well. Okay. Which subsequently, I'm going to talk about diaper rash in the later part of the segment and how we differentiate eczema from diaper rash. Okay. Some tips on how to manage your child's fragile, sensitive skin. For eczema wise, just now I mentioned about having the genetic predisposition. So what happens when you have sensitive genes? We'll show the first slide that shows a defective skin barrier. When you have sensitive genes, it actually affects this skin barrier. So imagine your skin cells are bricks. Okay, so imagine a brick wall. Your skin cells are bricks when we look under the microscope, and there's a cement layer that needs to hold these bricks together. If there's a problem with your cement production, which happens with people then when they have sensitive genes, there's a problem with the cement production. So imagine a defective wall where you don't have good cement. We show the next slide, right? Where if you have a bad cement production, holes in between the skin cells, water evaporates really fast. So you'll find that the skin is very dry. And external irritants, for example, sweat or bacteria on the skin can get in through these holes in between the skin cells and irritate your skin. So it's a two-way traffic, and that adds to the problem. It is important to moisturize the skin, as what we mentioned, because moisturizing the skin repairs this defective skin barrier. Okay, moisturizing the skin is so important. It's the basic step to managing eczema. And sometimes just moisturizing to replenish the water, the moisture in the skin is not enough. We need to repair the skin. So imagine if you use a moisturizer, there's sort of a two-in-one function, repairing and moisturizing at the same time. So you save time, right? You just use that one layer, it can have two functions. So I would recommend a moisturizer that contains ceramides. This is an important word that you should remember, not just for your baby, but also for yourself, because anti-aging products also contain ceramide. That's a building block of collagen. Ceramides actually fill up the cement gaps, which I mentioned. Alright, it fills up the, imagine it as a cement filler, fills up the cement gaps in the skin structure, and as you apply it on your baby's skin, the cement layer is repaired, your body is stimulated to produce better quality cement, and your skin is more resilient. So in studies that have been done using the Ceradan moisturizing wash, is a gentle cleanser, which I'll touch on that later, and also Ceradan barrier cream to replace the ceramides in the skin. 80% of children actually showed significant improvement in their skin barrier function after about 12 weeks of use. Apart from moisturizer, a wash is also important, fragrance-free, and I think something very important, the Singaporean mindset, right? If you use a wash, if it's gentle, you need it to foam. Certain washes are so gentle, they don't foam, and a lot of people complain, I feel like I didn't shower, and I spent so long in the bathroom, I feel like I'm still dirty. So having a wash that foams, that lathers, but yet is gentle is really important. And later, we'll talk about the moisturizing wash. I'll show it to you. Okay, yeah. So apart from moisturizing and washing the skin, some tips as well. Use lukewarm water, not something too hot. Hot water day in, day out, that will injure your skin. Okay, something lukewarm or even cool water if possible. And at night, if you sleep in an air-conditioned room with your baby, make sure it's about 25 degrees or so. Not too cold. Something too cold will dry out the skin. Alright? Yeah. And a lot of questions that parents may ask: can my child go swimming? Yes, your child can go swimming. Don't deprive your poor child of activities that they like. Not just because they're limited by their skin condition. A lot of things they can't do. That's really miserable. Your child can swim. Before swimming, apply, like for example, the Ceradan moisturizer all over, and after swimming, shower and apply moisturizer again. Maybe spend maximum an hour in the pool. Okay, yeah. And also the next question is on the food allergies wise. I would say a lot. Singaporeans are just very preoccupied with food. Everything, whether it's all about food. Okay, but like what Dr. Chia mentioned, really a minimum number of patients with eczema, it is due to food allergies. Most of the time, it's not. Yeah. Okay, let me touch on diaper rash. Okay, this is a question hanging on a lot of parents' mind. How do you differentiate a diaper rash from eczema? So if your child has rashes around the groin area, the buttocks, and if you've not been changing the diaper as frequently as you would like to, then it's something to look into, because urine and feces in contact with the skin can irritate the skin. And actually, if you look at the folds, the groin folds itself, if you actually see red dots, those could be yeast infection. It means fungus infection due to the heat and humidity. That's where we can consider Ceradan diaper cream, because it does contain, first of all, ceramides. In this optimal ratio, same as the Ceradan barrier cream, this optimal ratio of ceramides, cholesterol and free fatty acids that helps to protect the skin, rebuild the barrier. And also it contains zinc oxide, which is anti-inflammatory, and also octanidin, which is an antiseptic. Yep. So this will help to protect the fragile skin and area, and you have to keep changing your diaper very frequently. That can help with each diaper change. Yeah, I'll take any questions at the end of this, and you feel free to shoot out your questions during Q&A. Thank you.
Thank you, Dr. Ker. Now, you mentioned the diaper cream, the Ceradan diaper cream. Is it true that when you put diaper cream on babies, you have to apply such a thick layer, it's white? I used to do that on my son when he was a baby.
Did you find it difficult to wipe off?
I never had a problem. I always felt like this is still better than him getting a rash.
True,
so if I'm going to protect it, then I might as well just slather it. But is it true you have to do that?
Yeah, let me show you. Sure. Yes, I would say putting a thick layer of diaper rash cream on the area itself can protect the skin, because it's a barrier for urine not being in direct contact with the skin. But a lot of parents do complain that putting such a thick layer is impossible to wipe off, and there's always a white residue. So I'm glad you didn't have that problem. But let me show you an example. If you apply on your skin, okay, and it's really quite white, for example.
Yeah.
And if I actually
is that the wash?
Ceradan, that's the moisturizing wash, which is gentle, and you can use it as a shower. And if I sort of rub it on the skin, this is a piece of dry tissue, and if I wipe it off, it actually goes off quite nicely. Alright, so I would think that you have to use the right products.
So it's not super sticky.
It's not sticky at all, and it's really easy. Just one wipe, it actually goes off. Yeah.
I'm going to try this skin barrier repair cream, because I found it very interesting what you said about ceramides. I mean, I always hear the word being thrown about, and now I finally understand it better. I suppose this is a bit like the diaper cream, right? Except maybe a bit less rich.
Less rich. The composition is a little bit different. It doesn't have the anti-inflammatory ingredients like the octanidin or zinc oxide. Yeah, there's a bit of a difference.
Very rich. Definitely hydrates my hands, and it's fragrance free. I have to say though, for parents who are tuned in, I know sometimes you want to use a baby wash on our babies that smell like babies, but try not to if you're, not try not to, but do not if your babies or your kids have sensitive skin, right? Because fragrances are irritants, aren't they?
Yes, that's right. You can develop allergies to fragrances. It's just a feel-good thing, but may not do anything very much for your skin.
Yeah, and also beware of essential oils as well, because that can actually cause skin allergies.
Yes, that's true.
Yeah. So we have the range of Ceratin products that we have talked about here for you to look at, and later on I'll be talking about how there are discounts on the Ceratin range of products as well. Thank you so much, Dr. Ker, for giving us all the tips. And I wanted to remind you as well, while you're checking out this webinar, please, if you have any questions, please comment below. And speaking of the comments section as well, we have $5 Unity vouchers that we're giving away, okay, to the first 300 people who participate in this. And to participate, you just need to do something very simple. Just look for the Google form that's pinned to the comment section below, key in your details, and we'll give you the voucher just like that. It's for use all the way to the 25th of Jan at Fair Price and Unity stores. There's a very small minimum spend of only $25 on health supplements and also toiletries. So hurry, look for the Google form pinned to the comment section right now and fill it in. While stocks last, only 300 of them. Ms. Zhang Weijia is here with us today. So we've heard from 2 dermatologists, and now we're going to hear from a certified nutritionist with 8 years of experience in the health and beauty supplement industry. She's from Haibo Group, who is the leading supplement company specializing in beauty and slimming and detox supplements. Weijia, it's really good to have you here with us today. And I understand you're going to be talking to us about that magic word that we women love to hear, collagen. Tell us about what.
So thank you for having me today, Jamie. What I'm going to talk about today is about collagen. Collagen, right? We hear this everywhere. We have it in creams, we have it in supplements. We even have collagen soups nowadays. But the big question is, does collagen really work? We hear that it can do everything, hydrate your skin, help you with wrinkles, so many things. But does it really work? And if it does, is it really enough for us to keep youthful? So once again, I'm Weijia. I'm a certified nutritionist at Highview. So I've spent the past 8 years helping men and women look and feel their best through wholesome additions to their diets. And yeah, let's dive into the main topic, which is collagen. So before we say what does it work or not, let's understand more about what exactly is collagen. So collagen is actually a protein that makes up 70% of our skin. So when we touch our skin, there's a certain thickness and bounce to it when we're younger, and that's because of the collagen that is there. Which is why when we age, we can for the elderly, you can take their skin up. It's like paper, it's very thin, there isn't much bounce, there's wrinkles. So that's because of the reduction in collagen. And okay, so there are 3 types of collagen products that's mainly on the market. Number 1 will be collagen creams. So collagen creams, do they work? Unfortunately, most of them don't really work because it's very hard for our skin to absorb the collagen directly. Collagen molecules are usually very, very, very big, so they cannot be absorbed into our skin. It's just like we want baby skin, but if we put baby on our skin, right, it's not going to become baby skin. So collagen creams, unfortunately, they're still going to function as a good moisturizer. And as Dr. Ker and Dr. Paul shared just now, moisturizing is super important. So yeah, keep yourself moisturized, but the collagen part, not so much. So a second way that you can increase the amount of collagen you have is through collagen injections. However, many people find it kind of invasive. Maybe a bit of myself as well. I'm afraid of getting poked.
Only because you're very young, that's right.
Yeah.
Wait, 10 years.
Yeah. I might consider it later on.
I'm kidding.
Yeah, because it's also very expensive. So each time it's going to cost you hundreds and sometimes even thousands, and you have to top up every few years. So it's not very practical sometimes for the large majority of people to go for collagen injections. Now the last one, I think we're all interested to hear this. We've had a lot of talk about this today, which is food. So can we eat collagen then? Will it absorb? Okay, I think for the past 5 years or so, there's been a lot of collagen soups coming up and collagen hot pots, right? I've eaten them also. So while you can take in some collagen from there, the thing is the collagen is not usually it's not optimized. The molecules are very big, and it comes from cow or chicken sources. Not everyone can take it, and it's not the highest purity. So it's not the best. What's more, coming with the soup, right? There's going to be fats, there's going to be sodium, so all these things that you don't really want in your diet consistently every day, which brings us to collagen supplements. Now, we see collagen supplements everywhere, and one question we always get asked is, does it really work? And I'm going to share with you two pieces of research. Number one is a research by the University of Kiel in Germany. So they have researched that collagen supplements can improve skin elasticity significantly after 4 or 8 weeks of taking. And another one is by the Journal of Cosmetic Dermatology. So they have proven that collagen supplements, they are able to improve your hydration of your skin significantly, as well as help to really thicken the thickness of collagen in your skin, which is what you lose, right, by becoming thin. So the answer is yes, collagen taken through food, through supplements, it does work. And well, one thing, so for many years, that's where a lot of supplements in the market, they stop there. So it's like, oh, you know, we know that collagen works, so let's just keep selling collagen and that's it. But if it works so well, how come, you know, there's still so much aging going on? How come a lot of people are not convinced by collagen? That's because they don't really look at the root cause of why our skin stopped producing so much collagen that we need. And that's what we at Avalon team, we want to find out about, because to us, this is very personal issues. We are a team mainly of making supplements that will impact us, and we do a lot of lab tests on our supplements as well. So one thing we find that, okay, we looked for the real reason why we are losing collagen. So our skin cells don't just go like, hi, blowing up birthday candles, you know, you're 1 year older, bye bye collagen, I'm not going to take in, I'm not going to produce so much of it for you now. But okay, so what happens is that when we age, our skin cells itself is also ages. So aged skin cells, they, according to the Journal of Pathology, so they have actually a defective mechanism, so they are not able to produce so much collagen as they did before. That is why we don't have so much collagen. And according to the University of Krakow, this is a research that we base our product on in Poland. So we find that plant stem cells actually have the ability to regenerate our skin and increase collagen production. So for us at the team, after research and working with our partners, skincare specialists in Taiwan, we've come up with Avalon Stem Cell Beauty Drink, which is, for us, it's a two-step process. Step one, we repair our skin cells first through the stem cells, orchid stem cells, it's a patented formula. And then step two, we replenish collagen with very small molecule premium fish collagen that's very easy for us to absorb. So in this two-step process, we are able to achieve a lot of the desirable outcomes we want. So we've run extensive lab tests on this, 4 of them in 4 areas. One area is UV spots. We are able to lighten UV spots. Number 2 is in brightening and making our skin more radiant, so that also increases. And number 3, we are able to minimize the visual looks of our pores. I think this is something we're all very concerned with, especially with a lot of video chats nowadays. We want to look young. So the last one is what I love the most. So we were able to see after 4 weeks of consumption in our lab test, a 12.6% decrease in the visual appearance of wrinkles and fine lines. So you are looking younger. It works. So, and we at the team, this is what we want to do. We want to give products that works. So these lab tests, they are done in Taiwan, and so just in case, you know, they're not localized enough, we also did another local test. So in 2019 June, we ran a test with 259 Singapore testers, and 98.1% of them told us that within 3 days they could feel a difference. So slightly better radiation, their pores going down, looking more energetic, brighter, and less wrinkles. So this drink, we formulated it. It tastes quite fruity because we also use a lot of fruit extracts. So I would like to invite Jamie.
Okay, I need to ask everybody tune in right now is wondering how often do you drink this, because you have very nice skin.
Thank you so much. Okay, so for me, I drink it once a day.
Yeah.
But if I have some events coming up, then I'll drink twice a day. Once in the morning
So
and
you
once
can drink
at night.
twice a day.
Yes, you can drink
Okay.
twice a day.
Okay, so oh, you know, I'm gonna have to. Oh, actually, it's
Yes.
open already. Thank you.
Yeah.
Because my
So-
hands are very moisturized.
Yeah. So we use sparkling water, so it boosts
Oh, I
your
love
absorption.
Sparkling water boosts your absorption.
Yes, it does.
Oh, it's yummy.
Yeah. So it has
Can it
a
be used in
light
a cocktail?
Well, you can make a mocktail with
Okay.
it, but we don't want the alcohol interaction with it.
It is very fruity, and I can
Yeah.
taste. It's very refreshing because of the sparkling water.
Yeah.
But I gotta ask you this: okay, do you guys have a formulation that works in a capsule? Because some people don't want to
Okay.
drink, right? They want to just take the capsules. Is that like in the works, or do you have something like that?
We don't have it in the capsule form right now because we feel that overall the drink boosts efficiency much more with the addition of sparkling water. So because we
Okay.
want to push out products that really work. So for now we don't have it, but in the future we might be going into this.
It's yummy. Tastes like lychee.
Yeah,
Is it
does.
lychee?
So there's lychee juice into it.
Ah, okay, got it. Do you guys want some? Later. they look at me quite like with envy, you know.
So one bottle only has 22 calories. It's very light.
It is very light.
Mm.
That's amazing. Thank you so much. Thank you so
Thank
much
you
for
for
sharing
having me.
about the stem cell and collagen drink, right, from Avalon.
Yeah.
And later on, we'll be sharing some discounts that you can get at Unity of these products as well. Guys, thank you so much for sharing everything. And you know, we've had so many questions come in during the Facebook Live. So I'm so sorry we cannot get to all of the questions. But before we go through the questions, I'm just going to ask whether do you guys want me to mention the discounts right now or maybe later? Okay, so we're going to talk about the discounts right now because I just mentioned that we have them. Apart from the $5 Unity vouchers we're giving away as well, we do have massive discounts on some of the products we spoke about today in this webinar. So let's talk about the QV skincare products first. The QV creams going for 30% off. There's 30% off actually the QV Gentle Wash as well. Also the Flare Up Cream and the Flare Up Wash. Alright, so that was the range of skincare products that Dr. Paul talked about earlier. It's for managing adult eczema. And next up, the Ceradan skincare products that Dr. Ker talked about, how it's good for babies and kids. There's a 20% off the Ceradan Skin Barrier Repair Cream, also the Ceradan Wash, the diaper cream as well, which we were mentioning earlier, we showcased, you know, so if you have a baby in the house, you might want to take advantage of these discounts, so 20% off. And it says here 29% off the Avalon Stem Cell Drinks. There you go. You've heard the research and you can see for yourself that it works, right? So 29% off this. I get it free, by the way. I am lucky. The perks of the job. Okay, I better put this down actually. I've got more work to do. We are going to be doing the Q&A section right now, so thanks again for all your questions. Okay, the first question is for Dr. Paul. Dr. Paul, there's so many moisturizers out there. How do you choose a good moisturizer that's suitable for sensitive or eczema-prone skin?
Okay, so usually when we look for moisturizers, we want to look for a producer that has a good reputation, and one of them would be QV. Alright, and but how do we exactly look for appropriate cream? Firstly, like I was saying just now, the most important thing is to look at the ingredients. The cream has to have a pH balance. It must have no fragrance, and at the same time, they must have they must have preservatives that are hypoallergenic. And most importantly, in our local climate, which is humid and hot, we want something that is nice on the skin that, you know, we want to apply regularly. We will be able to apply regularly, and at the same time, it doesn't sting the skin, especially for people with eczema.
We've got a question, I guess, for both the doctors in the house today. What do you think about using probiotics for children as a sort of a skincare supplement? Because people say the good gut health, everything else works, right? Yeah.
So there are theories that having poor gut health in the sense like your microbiome, the microbiological milieu of your gut, if it's abnormal, then that affects the skin. Yes, there's some truth in it, alright? And that's where probiotics come in. I would say that so far the scientific evidence out there's no good evidence that using probiotics, oral probiotics, okay, either in form of powder or probiotic drinks, help with eczema directly. But if you already have bought them, I would say no harm. Okay, probably more research is on the way. However, right now, not robust evidence.
Thanks for that, Dr. Ker. Angie Chu has a question. Does collagen help to improve skin? Okay, I guess any of you can answer that. Right?
Yeah, definitely. It does help to improve skin. So I mean, it is what our skin is mainly made of. So I explained just now, it's about taking it in the correct ways that we can see improvements in our skin. So example of reduction in the appearance of wrinkles, helping to brighten our skin, helping to hydrate our skin.
Cool. So remember our 29% off. Alan Tino, you say, I have eczema. My skin is no longer red and itchy, but my dry skin is unsightly. Will QV cream work for me? Dr. Paul?
Okay. Oh, certainly. So you probably have eczema and you have eczema-prone skin. So what's happening now is that you are no longer inflamed, but your skin still remains dry. So you're genetically predisposed to eczematous skin. So yes, certainly I would strongly encourage you not to just stop at using QV cream, but also to use the QV wash, because the QV wash is also protective of your skin, and the QV cream further moisturizes your skin. And certainly if you use the creams regularly, and you need to continue to use them, your dry, skinny skin will certainly improve. Thank you very much.
Thanks for that. Does taking collagen help with eczema conditions? I think I'll let one of the doctors answer that. Dr. Ker, perhaps?
Sure. All right. So if you're thinking about taking a collagen drink, like what was mentioned just now, if that helps with eczema, remember I mentioned that eczema is not just caused by one thing. For example, it's not just caused by collagen loss in the skin. There are many factors involved, genetic factors which you can't change, and external environmental factors. So collagen just plays a part, all right? Yeah, but you should still get to the root of the problem, where you look around your relatives, anyone has any eczema or sensitive skin, sensitive nose conditions, and eliminate the environmental triggers where possible. You can give it a go, you can try the collagen drink, but still, gentle washes and moisturizers have to be incorporated. So look at the big picture.
Thanks for that, Dr. Ker. And Ms. Zhang, I think this is for you. Are there any ways for consumers to actually test the quality of collagen? Well, I know you cannot do it at the Beauty in a Pot, but what about your brand? Is there any way?
So what you can do is ask about the size of the collagen peptides, and also ask what's the source of the collagen. So one thing is we try to take fish collagen. This has the highest purity. It's the best one. It doesn't have as many other impurities and allergens as the other type of collagens. And number two, you can ask about the size of the collagen molecule. So like I said, why we cannot absorb it through our skin is because the collagen molecules are too big. So the big ones can be 50,000 daltons is the unit size. And so what we want to drink is between 1,000 to 3,000 daltons. That's very small, very easy for us to absorb. And that's a testament to the quality of the collagen used.
Okay, so ask about the molecule size. There you go. That was your answer.
Yeah.
I'm afraid that's all the time we have for the question and answer, but I just want to remind everyone that we have massive discounts of up to 30% off all these products we've talked about today in this webinar. We also have that $5 Unity vouchers that we're giving away. And I don't know whether we've given it away already, but let me just give you the details. We've got 300 of them to give away. Very simple. Just click on the Google form below and then register your details, and we'll give you those $5 Unity vouchers. We've also got QV starter kits. For those of you who want to try out the QV skincare products that we talked about here today, we're giving those away. We've got 200 starter kits to give away. It's the same process. Look for the QV form, pin to the comment section, and then fill in your details. Any last words you guys want to say before we sign off?
Yeah.
Dr. Ker, you want to go? Because this is a surprise, okay? It's a surprise question for them. Dr. Ker, is there anything you want to say to everybody?
Take care of your skin, take home points, gentle washes, moisturizers, all right, and be diligent about it.
Yeah. Okay, my point would be that eczema is not just about a single thing, like what Dr. Ker has also said. Eczema is about combination treatment, and most importantly, remember to moisturize, moisturize, moisturize.
Yeah, and I think the last thing is we are what we eat. So really be careful of what you're eating. Be mindful about them. A treat once in a while is perfectly fine, but make sure you're getting your key nutrients and vitamins and anything else your body needs.
Thank you so much for tuning in to this Unity Facebook Live. This has been the first of a series of webinars called Unity Beautiful Inside Out. We'll see you again.